Hello everyone, I am Dr. Nithin. I am an orthopedic surgeon in Yashoda Hospital, Secunderabad, and I specialize in arthroscopy and sports injuries. Today I would like to talk to you about frozen shoulder. I am sure a lot of people have heard about this condition. It is a very painful condition of the shoulder. What this does is not only pain, it also restricts the movements in all directions, so you are unable to move your shoulder. You also can have a severe night pain which affects your sleep. If these symptoms are there, then you could be suffering from frozen shoulder. How do we treat this? It's a very painful condition to ignore, and treating also is very challenging. In the initial stages when you present to us, treatment can be easy with good physiotherapy. As the stage increases, we may have to deal with other procedures, sometimes injections like hydrodilatation injection, or very occasionally we may have to perform an arthroscopy like a surgery to release your frozen shoulder. But let's come back to the initial stage and hope that you don't move to the next stage. Frozen shoulder can be affected in diabetic patients, so taking care of your diabetic condition is very important. And in the initial stages itself, if you start very good physiotherapy, then the results are going to be excellent. I would like to request Dr. Sumanth to demonstrate and tell you about frozen shoulder condition.
Hi, I'm Dr. Sumanth, head of the department Physiotherapy. I'm specialized in musculoskeletal sports and manual therapy. As it was mentioned, the frozen shoulder is a very painful condition. In physiotherapy, it has to be planned very well and it has to be managed in terms of electrotherapy as well as exercise therapy. Overdoing of physiotherapy in this particular condition is not good, and it may sometimes worsen the conditions. Today I will show you few exercises which you can do at your home easily. I think these exercises will help you. Range of motion restriction is a big problem in frozen shoulder. To increase the range of your shoulder, you can use the soft balls, which you can get easily in the stationery stores. You can keep the ball in this position and you can start doing these exercises. This helps in increasing your abduction range. This is the short lever exercises. This exercise the patient can perform very easily. For increasing the flexion, turn around. Okay, in the same way, move up and down. Move up and down. Daily, you do it for 10 times and thrice a day. Okay, now long lever. Next progression is taking your hand into long lever. In this, the keeping your elbow straight. Okay, try to move the ball up and down. Okay, with this, the ball actually helping the patient in assisting for a free movement. With this, the patient can perform exercises very with ease without giving a much pain. This helps in increasing a flexion. Next, abduction. Next, turn around and try to move your hand up and down. It helps in increasing your abduction range. Next is band exercise. Which you can use a simple stick which is available at your house. Okay, hold the hit stick like that, or take the hit stick overhead, take it behind and slowly get the stick behind your head. With this, you can stretch your pectoral muscles and you can stretch your anterior capsules. Okay, which is very helpful in frozen shoulders for increasing the range of motion. Other band exercise. Keep a stick between your hands and move the stick either sides. Either side, make sure that your body should not move, only you should get a movement from your shoulder. Repeat this for 10 times and twice a day. After increasing the range of motion, it's very important to increase the strength of your shoulder muscles. This can be easily done with by using the elastic bands. This is the specific exercise which he is performing that helps in increasing the strength of your rotator cuff muscle. And these exercises can be done at various angles to strengthen all the rotator cuff muscles. This is the specific exercise to increase your internal rotation. With this you can use a towel or some specific bands. Okay, you try to pull your right hand up so that your left hand starts moving up. This slowly helps in increasing your internal rotation range. This has to be performed within the pain limits and it has to be increased very gradually.